Welcome to Sex, Love and Science with Lauren Muratore, clinical psychosexual therapist and relationship expert. This podcast explores sexuality, relationships, and the many facets in between, aiming to normalize sexual conversations, issues that we all face. Let's take the taboo out of sexuality and open up the conversations for a better sexual existence. I would like to begin by acknowledging the traditional owners of the land on which we are meeting today, the Wurundjeri people of the Kulin Nation. I pay my respects to their elders, past, present, and emerging.
Well, welcome back to Sex, Love and Science. A little bit of a change just in terms of the podcast episodes. I missed last week, so apologies to everyone who's expecting an episode. I'm going to be doing fortnightly now, and because we're going into the silly season and holidays, you're going to be missing a couple around Christmas and New Year's, but we will be resuming season 4 at some stage. So stay tuned for that. Today I'm switching gears and I'm going into penis health today, which is exciting because I've done a lot of vulva anatomy, a lot of vulva discussions, and today we're going to talk all things penis health. And I have Adam Cuthbertson-Chin here. Did I butcher your surname?
Yes, that's right, Cutherbertson-Chin.
Okay. Who is a nurse practitioner specializing in urology. Adam, do you work at a few different places?
Correct. Yes, I am in a few different places around Melbourne.
So I thought you'd be the perfect person to talk about penis health with, especially because, you know, you're looking at the medical side of things. And I don't know about you, but I get a lot of guys. ED is one of the biggest things that I do work with, who the common misconception is there's something wrong with me. There must be something physically wrong with me. So generally I find they start with a GP checkup and find that they get the testosterone checked. And is that kind of what you would find?
To some degree, I would say, yeah, that there are some varying starting points for the patient's journey into looking into their erectile challenges. But usually, yes, they will go to their GP initially and have an initial consult to try and determine if there's any initial causes for their erection problems. But then ultimately they would most likely end up with a specialist in that field to investigate further and discuss other options in terms of treatment and what can be done.
Yeah. So, if testosterone wasn't an issue, right, and I start looking at the biopsychosocial side of things and, you know, we're unpacking that, but what could somebody be experiencing, you know, I guess from a medical perspective that would lead to suspicions that they would need, you know, medical interventions?
Yeah, sure. So if there's organic erectile dysfunction sort of starts off fairly discreetly or slowly, where the man might be noticing some less rigidity with their erections or less ability to sustain their erection once they get one. And it depends a little bit on the age of the man as to which angle we go with first. So if it's more of an older gentleman, then the first thing we actually want to clear or make sure of is that there's no cardiovascular risks, because we know that increased in cholesterol, diabetes, cardiovascular disease, hypertension, things like that can impact on the man's ability to get an erection. And that's purely because of circulation and decreasing the blood flow to the penis to enable them to get rigid and sustain their rigidity. But then also, I guess, when it compounds, when a man starts to have challenges with their erections, that then it goes into more of the mental side of things as well. And that can catastrophize the issue, which obviously that's why we work in combination together often with patients to work towards both their social aspects of their health as well as their medical.
Yeah, exactly. And the catastrophizing is so easy to do. As you were kind of explaining that organic process, I'm just alerting everybody listening that if you're losing a little bit of an erection, you know, occasionally here and there, it doesn't necessarily mean there's something medically wrong either, that sometimes penises just don't work. Just normalizing that sometimes there's no issue.
Yeah, absolutely. Yeah. So there can just be one sort of incidence where there might be other factors going on in your life. You're having a stressful period during work times, or there's some other outside life, challenges that are happening that can impact on a particular period of time for a man. And then when those challenges are resolved or dealt with, then often everything goes back to normal.
Yeah, well, and that's good news for people hearing. And I like how you touched on like healthy heart, healthy penis. I talk about that a lot with clients as well. But question for you, because this is one that I'm curious about, is, when I'm running through, what's going on with, my male client who's experiencing ED, I'll ask them about, what's the heart doing? Do they get their morning erections? Do they get their nocturnal erections? And I get various responses, of course, obviously, but I find that even irrespective of the age, sometimes a lot of the guys their morning erections are infrequent. I'd love to hear your professional opinion on that.
Yeah, sure. Well, so when a man is much younger, when in their teenage years or early 20s, they tend to have a lot more of their sex hormones running around through their body, which delivers a lot more of those nocturnal and morning erections. But a man can certainly have normal hormone levels, and as they age, they can still have that diminishing in terms of how frequent those nighttime or morning erections occur. And that doesn't necessarily mean there's a hormone imbalance. It's just the way that the human body works as people go through the decades, basically.
Yeah, that makes sense. It's just the aging process. I am finding that a lot of my younger guys who are, probably 20 to 30, who are having like ED, as a primary ED, right? So a lifelong sort of, they're when they finally come to speak to me, they're experiencing a lot less morning erection. They're not sure about the nocturnals, but is that necessarily signifying a hormone imbalance, do you think?
Not necessarily. No. So it can. We run the tests on these men to find out just for sure whether they've got some hormone imbalances, and more often than not, they're actually quite normal, or they might be on borderline low testosterone levels, but not necessarily warranting any treatment either. So it can be a normal, process of the human body to go through that. And I would like to think actually that these men are still experiencing those nocturnal erections. They just don't know it. Exactly. And they're probably having one before they wake up, just before. And that's just the way that their REM sleep, that deep sleep, is occurring, and the cycles that they go through during sleep.
Yeah. Okay. No, that's a really good point. I'd love your opinion too on testosterone, right? Like there's a lot of stuff on TikTok, about what's too high, what's too low. Could you comment on testosterone, the role it actually does play in erections, and I guess what normal health looks like?
Yeah, well, so clinically, the normal range for a testosterone is between 10 and 30 millimoles per litre. But clinically treatable low testosterone needs to be consistently below 6 or 7. And when I mean consistently, we never take one test as gospel. We always have to repeat it sometimes 2 or 3 times to make sure that it is actually clinically low before we start treating them with other medications or creams or even injections to increase their testosterone levels. But also, I guess, there's constraints within the Medicare in Australia with how it's funded as well, and that's another component as to why we need to run those tests, because there's criteria that the clinician needs to meet in order for the patients to be able to meet the Medicare and PBS requirements. With the testing of the testosterone, it's really important that men get their blood taken between 8 a.m. and 10 a.m. in the morning each time, because there's peaks and troughs to the natural peaks and troughs to the testosterone levels through a 24-hour period. And if we always test it during a shorter, smaller window each time, then we are comparing the data relevantly rather than comparing apples with oranges type thing.
Thank God you said that, because that's what I tell people. That's what I always thought. But I love hearing that from you, because that's not my area completely of expertise. But thank God I'm giving people that that knowledge as well. Phew. And exactly, because a lot of people think, oh well, my testosterone was low or high here, and it's those apples and oranges approach. And I think a lot of people press the panic button too, like I'm on borderline low. Could you maybe talk about what somebody who is clinically low, what could they be experiencing? Like what sensations? Because a lot of guys will think, oh, my libido's changed, I must have low testosterone.
Yeah, sure. So that is one of the contributing symptoms of low testosterone, is the lower libido. There is also a lot of fatigue that these men experience, a lot of demotivation in their just general life, whereas, compared to perhaps where they previously, when they had normal testosterone, they would be quite motivated during life and work, professional lives. So those are the main three symptoms of low libido for men: the libido, fatigue, and motivation.
Yeah. Well, I guess not dissimilar to perimenopause.
Sure. Not sure about that. That's a bit out of my wheelhouse, sorry.
That's all right. I'll do a show on that another time. But yeah. Well, I guess we can all agree that aging is a little bit of a bitch sometimes.
Absolutely. Yeah. Every single older person says to me, oh, can't you just give me a pill to make me younger already?
Do they say that?
Yeah, absolutely.
So what protective factors can people really do for, I guess, to maintain a healthy, not just a penis function, but like a holistic health?
Yeah, well, it comes down to the basic stuff, really. And this is not going to be groundbreaking, but it's more to do with just the decreasing stress, anxiety, depression, making sure that's getting treated properly, relationships, making sure that they're sound and working well, but then also other physical things like decrease or absenteeing of smoking, and vaping is actually a really big one that we're starting to find more problems with men with lower testosterone that are vaping. It doesn't happen to all men that vape, but there is certainly some cases that are coming through that once they stop vaping, that their testosterone levels renormalize.
Wow.
So we're not really sure why that's occurring. We don't really understand vaping too much just yet, but that's something we're seeing. And then there's other things like diet is really important, and there's a lot of studies out there to show that plant-based diets are really good for our overall health, but also for the sexual function needs of men and women. Alcohol use is a really big one. So reducing or really limiting the alcohol for men that are struggling with their erections might be a good thing to adjust. And then just keeping regular exercise. So good for their cardiovascular health, and also getting good sleep. So we know that people that have poor sleep generally have they can have a poor cardiovascular health.
Yeah. Yeah. And yeah, I mean, as you said, that all makes perfect sense. And I think sometimes people forget that that's really all necessary, and it's the expectation of, well, my penis should just be fine, or, we should just be working. So yeah, we do forget all those basic sort of general health. It's probably disheartening as, the client coming in to see yourself, me, or a doctor, and we're just telling them to eat well, to drink some more water, exercise, and, how are you going to de-stress? But unfortunately, we're all saying the same thing.
Yeah, exactly. Like the basics are so important, and we take it for granted, really. And a lot of us as human beings just want to have that quick fix. But preventative health is so important, just for our own general health, but of course in our sexual function needs as well.
Absolutely. And that's why I wanted to ask you that question before I dived into PDE5s and you're right, is that quick fix. I mean, I'm not sure about you, but I've got a lot of guys who come in and think it's just really easy to take Viagra or Cialis and everything's going to be fine. And why don't these pills work?
Mm-hmm. So in order to understand how these medications work, you have to understand how natural erections work and the mechanism of how they come to be. So essentially, in a very, very basic sense, the erections come on by the man being aroused or sexually stimulated, and there's messages that go from the brain down the spinal cord down to these nerves that surround the prostate. Now, in a basic sense, they release a chemical that then dilates the blood vessels and they get an erection. So what the medications do, like Viagra or Cialis, they just essentially enhance that chemical reaction at the time that you're aroused to help you gain an erection, but also keep one. So the timing of those medications is really important and how to take that. So it needs to be administered or swallowed about an hour before they want to engage in sexual activity, because it needs to be absorbed through the gut down at the site of those nerves by the time that they will work. The other factors that impact on their absorption is food. So I often say to patients, just avoid having a meal at the time that you're taking the medication. But in particular, it's a high-fat food that is the main problem there. So if you're going to have a salad, it probably wouldn't make much of a difference. But if you're going to have like a pizza, then it definitely would. And then the other thing to abstain from with those medications is alcohol. That is a neurodepressant, therefore going to decrease the neuro messages that are occurring from the brain. So therefore decreasing the ability for those medications to work properly.
Thank you so much, because that's pretty informative for people. Talk about, when they should take the medication, but, what food and if you should be having food at all, I think is really pertinent advice, because, I would have never thought don't have that pizza. And a lot of people have that drink or that glass of wine to just relax the nerves and to prevent their brain from ruminating about what their penis is doing. And so it's all just counterproductive.
Mm-hmm. Yeah, that's right.
Just again for more clarity. So it's my understanding that Cialis stays in the bloodstream longer.
Yeah, that's right. So the Cialis has a half-life of about 36 hours, whereas comparable to Viagra, it's only really short. It's only about 4 or 5 hours, the half-life. But the onset of those type of medications are generally about the same, about 45 minutes to an hour. There is another one available called Spedra, or Avanafil is the generic name. That is a much quicker onset of about 20 minutes. So there's another possibility for those medications for men to use if they want to have a little bit more spontaneity to it. But they're just, unfortunately, quite a lot more expensive. So that's a bit of a barrier for some patients as well. They're generally about, from memory, I think about $20 a pill or something like that, whereas the Viagras are really cheap. You can get 10 tablets for $15. So, yeah. More bang for your buck, I suppose. Yeah, exactly. Yeah, no, it just depends on the patient's needs and how they want to use the medication and what they want to achieve, essentially. So for example, men or couples that want to engage in sexual activity first thing in the morning, sometimes that's their general routine. So instead of waking up and setting the alarm an hour before they want to do that, they can take a Cialis before going to bed, and that would generally still have an effect in the morning, whereas the other medications would not.
Yeah, that's a really good point and good tip for people at home listening. On Cialis, I also find that a lot of patients will sometimes be having very small dosages daily in order to keep it in the bloodstream. I'd be curious to know what your experience of, how helpful that is to clients.
Yeah, so we definitely trial different regimes of the medications with patients to see on the response. So there's a 5 milligram dose of Cialis that you can take every day, and that just provides a low-level therapeutic effect of the medication within the body all the time. So for those men that can still somewhat achieve some rigidity, but might not be firm enough naturally or be able to sustain it as long as they would need to, then that can be a good medication to just have on a daily basis to help them have that ability to be spontaneous, but have the effect of the medication just running underneath. Whereas the 20 milligram tablet is a more of an on-demand dose, and that's where you take it when you want to have that sexual activity an hour after you've swallowed it.
Yeah, no, that's a really good point. And I'd imagine that's probably a good discussion for them to have with yourself or, their doctor before they start experimenting on their own, just to see if they should be doing that.
Yeah, it just depends on their degree of erectile dysfunction, essentially, and to see what's really going to be most effective. And some people just don't want to have a tablet every day. They might, I call them the ABCs, the anniversaries, birthdays, and Christmases, that they just want to have that ability to do it on those special occasions. So they don't have to have a tablet 365 days a year. Those type of little situations or different nuances to the patient's needs make the difference to the treatment regime.
Yeah, that's fair. And is there any, I guess, from your knowledge, is there any, I guess, harm from taking it daily over a long period of time?
No, we haven't seen any research to tell us that that's going to impair their natural ability going forward or impact on their general health. There is some risk factors involved, coming back to the cardiovascular risks. So because it is a medication that is ingested through the gut, it does run through the whole circulatory system, so it can impact on the heart's ability to function properly for men that are have histories of cardiac arrest. Heart attacks, or stenting of the coronary arteries. That would be something that we'll be a bit cautious about with those type of medications, and talk about some other treatments that are a bit more local to the penis rather than systemically. And then there's always, potential side effects to these medications as well. And not everyone experiences the side effects, but some do. And with these type of medications like Viagra and Cialis, there can be headaches, facial flushing, some vision changes, particularly with the Viagra. You can sort of have this sort of blue haze in your vision. It'll be like you're under a chlorinated pool with your eyes open. And then another one particular to the Cialis is that they could develop some lower back muscle pain or even upper leg thigh pain. But it's not everyone that experiences those things. And sometimes they're quite mild and still able to tolerate the treatment.
Yeah. And, and I guess I speak about some of those implications and how unsexy they are, right? So it's we're trying to, as you spoke about earlier, it's how can we stay aroused, the subjective and objective arousal perspective, and then also deal with some potentially really negative thoughts and have, these side effects. It's kind of, a tricky, murky waters.
The tricky balance. And then that's why we always give all the information. I'm very thorough in my treatments with patients. I get them to understand exactly what's going on and what the medication does or could do to their bodies, so that they're fully informed. But at the end of the day, also, what I like to do with patients that are struggling, particularly the younger clients that are dealing with some erectile issues, and that's catastrophizing in their mind, and it's making things worse and worse over time, making their erections not as nowhere near as good as what they used to be, is that they can start by trialing a medication to help them gain the rigidity that they're looking for, and that then in turn increases their confidence to be able to I don't like using the word perform, but you know what I mean, like sexually provide. So yeah,
positive enforcement. I totally agree with you, because it's kind of like it's the inner monologue's like, cool, my penis works now. Like it's back to normal. And putting, it's and you're right, it does do that. But thank you so much for commenting on younger guys that you see, because I think there's a massive myth of every single young guy who's ever come in is like, I'm the only young person who's ever experienced this. And I always tell them, like, I have clients from 18 to like 70 who are coming in with, erectile issues.
100%. And I always usually comment on, how the it takes a lot of courage for men to come forward with these type of concerns and go to their GP or come and see someone like me or yourself about these very private and intimate issues within their life. And they do think that they're the only person going through this. But it is much, much more common than what they think. Statistically, we know that from research is that from about the age of 40, I'm just generalizing here, but from about the age of 40, there's about 40% of men in the community that have erectile dysfunction problems. And then it just increases by 10% every decade they get older. So, for example, people in their 70s, 70% of them will be having challenges. So it is much, much more common than what they think it is.
Yeah, and I go over those exact same statistics. So thank you for there's so much alignment here. Just one other thing that I think would be helpful to talk about is you mentioned a little bit before about different degrees, or I think you used different kind of, the different types of ED. Some people will experience different, could you comment on maybe different degrees of ED that you see, and, what would be, say, something that needed medical intervention versus something that's less severe, and the younger person who might take a pill and finally get that positive reinforcement, and then they start having sex again. So I'd be curious what you see.
Sure. So a lot of the guys that I see have had prostate cancer. And so they have gone on to have that treated either surgically with their prostate removal or through radiation. And the nerves that have surrounded that prostate have been either, damaged from the removal of the prostate, or at least what I say, battered and bruised from the surgery and the radiation. So a lot of those men need, more intensive treatment, I suppose, to keep their penile tissue healthy, so that in time the nerves have got time to rejuvenate, which can take a couple of years after that type of surgery. So if we don't enable the penile tissue to fill with blood and keep sort of stretchy and elastic, I say, during that period of healing, then over time, as the nerves might get better, the penile tissue is no longer viable to use. So we lose our erections that way. So I work a lot with men that have had that treatment done, and not only allows them to have some sexual activity happening during that recovery phase, but also in the long run, hopefully they'll have their natural erections back, and they won't have to worry about treatment anymore. But there's also other aspects to it as well, that outside of the prostate cancer field, and that's really just comes down to any pelvic surgery. So bowel surgery, hernia repairs, bladder surgery, anything that's really sort of close to those nerves down in the lower pelvis area can impact on erections. And then there's other neurological conditions like, MS, Parkinson's, things like that just in general impair the nerves activity.
Yeah, no, that's it. That's and I'm sure that and more people are affected. That and it's common, unfortunately, and there are a lot of people going through this, as you say, and I guess also then there's probably, like we know diabetes and diabetes medication, and SSRIs would also be contributing factors as well.
Yeah, absolutely. So we don't fully understand the SSRIs and the impact on the erection or sexual function. Even in general, we don't understand fully how those medications actually work to start with. I mean, we have a good idea, but we're only guessing. So the impact on the erections for some of those medications to treat anxiety and depression is a bit of a challenge, right? Because they're prescribed for a reason, but still at the same time we can work together and formulate a plan in how to become sexually active again. And it might not be tablets in that case where they're disrupting the neural pathway for those nerves to be functional, but it might be also the use of a vacuum device or a penis pump or even injections. more advanced cases, or where we'll potentially tried other medical therapies and they're no longer effective, there's also a surgical option, which is the implantation of a prosthesis. But that's generally used as a bit of a last resort, but can still be very effective and provides the men with much more spontaneity and reliability on their functionality as well.
Yeah, it's a new lease on life, really.
Mm-hmm.
From the cases that I've heard.
Yeah, the men that go down the surgical path and have the prosthesis inserted, it's an absolute. I love doing that type of work. It's just the change in their demeanor and their outlook on life is just instantaneously resolved, really, and it's fantastic to see.
Yeah, absolutely. And that's one of the rarer cases or specifics where it is so like night and day. Just one further question. So I don't want to keep you, but I was just curious when you were talking about when you were working with prostate cancer, and making sure the penile tissue was healthy, right, as the nerves regenerate. Are you getting them to do, is this like solo work? Because I always use the, if you don't use it, you lose it sort of motivation. But are you encouraging partner play? What do you kind of look at?
Really comes down to the individual and what they feel comfortable with. So all we're doing with that treatment is keeping, as I said before, the penile tissue healthy by encouraging blood flow to the penis and keeping it stretchy and elastic. So what we're trying to do there is mimic the natural response to erections. So for a guy when he was younger and he had his natural erectile ability, he was getting 3 to 5 erections every night. But post prostate removal for prostate cancer, where they can't get any erections in the short term at the beginning of their recovery, they can't do those nocturnal erections. So we encourage them we give them medications like Viagra and Cialis to encourage the nerve recovery, but also encourage them to use either a penis pump or injections to mimic that nighttime erection.
Yeah. What I forgot, the penis pump that I would normally recommend is the brand in America.
Okay.
Which penis pump would be your go-to one?
Yeah, my go-to one is a pump called Vacurect.
Okay.
So Vacurect is a very well-studied pump in terms of comparable pumps, where it's shown that it's the most effective, but also they're pretty much the easiest to use, which is fantastic. It allows the men to visualize through a clear cylinder through the pump as to what their penis is doing. And it's a manual pump. There's no battery operated one, and it's actually one of the cheaper ones in Australia, which is around about $350 for this Vacurect pump. But some of the more expensive ones that really don't do anything better, it costs like $700 or $800. So I always really push mostly to the Vacurect device. And they can also, if they've got private health insurance, because it's a TGA approved device, they can request through their health fund a rebate on that device and get some money back, possibly.
Yeah, wow, there you go. I think that might be the one I'm thinking of. I just can't remember, but I've watched the videos of how to put them on with the ring, and it's I think it sounds a bit daunting for a lot of guys, but by the sounds of it, it's incredibly useful.
It can definitely help in terms of the penile rehabilitation, I call it, after the prostate cancer surgery, but also for any general purpose in organic erectile difficulties as well, to allow them to have that control, I suppose, over applying the device onto the penis, making it rigid. Yes, you've got to have a constriction ring on at the base of the penis to keep the rigidity once the pump has been taken off. But it allows them to, I guess, have the confidence that they can control it, right? Whereas compared to the injections that I teach men to use as well, a lot of men are just apprehensive about these injections, and fair enough. So therefore they go down the pump pathway. But I just wanted to touch a bit more on the injections as well, because a lot of people have a lot of fear about those injections, which, understandably, putting a needle into your penis is not the most natural thing to think to do. But it really doesn't cause any pain like you'd think it would. It's going into a sensitive area, but it's really quite manageable. The only thing you feel is a bit like a mozzie bite, honestly, as the very thin and very fine small needle goes into the penile tissue. And it has a response within about 5 to 10 minutes, and lasts a roughly about 30 to 45 minute erection. And it provides them with more of a natural, in quotation marks, erection, because it does stand up like an erect penis would. So I guess if we're talking about the injections, I just want to reassure men that it's not as bad as what they think it's going to be.
Yeah, thank you. Thank you because I say that as well. And, I kind of suggest maybe that could be the route for some people after they've tried, and based on, health and age and all, and kind of looking at, well, maybe, you should really see a urologist and look at the injections. And a lot of people go, absolutely not. Like, they're like, no way am I sticking a needle in my penis. And I'm just like, but they're pretty instantaneous as far as I know. Like, why would you not want to have? That's what you're wanting. This is going to give it to you.
Yeah. And it's, definitely, if I had $1 for every time a person said that, that wasn't that bad after each time they've done it for the first time, I'd be retired by now.
Oh, jeez. But just also to clarify, that's probably not the first thing you would go to. It's not the go-to.
No, absolutely not. Not for organic erectile difficulties. We'll definitely start with tablets, see the response of that, and then also working on their confidence as well.
Oh my gosh. Well, thank you for all this brilliant insight. And I love hearing, thank you for confirming things that I've said. I just need it's good to know that I'm giving the same information. Is there any key takeaways you want to leave us with, or a moment of reflection?
I think it's at the end of the day, if there's challenges with erections, be reassured that you're not the only person going through this. There's going to be a lot of men that you would walk past every day on the street that have this issue. And it does take some courage and so I guess strength to approach this issue with a medical practitioner or a therapist. But there's certainly great help available, and you can always reach out to your GP or anyone else that's around you, to any other medical professional around you, to get some assistance. You don't have to suffer in silence.
Perfect. That's brilliant. And not suffering on silence. I'm going to pop all of your info in the show notes, so that way, if anybody is suffering in silence, that they have a resource to go to. And just from my understanding, they don't need a referral. They can just kind of give you a call and you triage from there. Is that correct?
Correct. Yeah. So nurse practitioners are a little bit like general practitioners or GPs. So you don't have to get a referral to go to your GP. So it's just like that.
Awesome. So if anybody's listening and you're, stressed about your penis health, Adam, go check out Adam, and you're in Melbourne and
Moorabbin.
Okay. Thank you. All right. Well, appreciate your time today.
Thank you so much for having me. Pleasure.